Hey guys, welcome back to another video. This video has come up a bit late as I had my university exams for the past some months, and this video mainly focuses on how the pattern of examination is different from the previous year exam patterns, and I'm going to mainly speak about what are all the changes that have been made in the competency based medical education that has been introduced from the 2019 batch. So let's get started. So guys, first things first, when we say there is a change in the curriculum, it does not mean there is a change in the syllabus or volume of the content that you have to read and cover. It has remained the same. The volume that you have to read or the syllabus that you have to read will always remain the same, but the only thing is the introduction of competencies. Let's understand what are these competencies. Competencies are nothing but the topics which you need to give some priority. These are the topics that from which there is high chances of asking the questions in the university exams or whatever exams. These competencies are must know topics to every student. It doesn't mean you need not read the other syllabus, or you have to skip these questions, or you have to skip that topic because it's less important, or nothing like that. These are the competencies which you must, competencies are the topics which you must know, which you must be thorough with in order to score well in the examinations. In the university exams, even in my university exams, there were many questions relating to the competencies, and if you are thorough with the competencies, then you have high chances of scoring more in your professional exams. Now coming to the exams, this is where the pattern is a bit changed from the usual exam patterns. This exam pattern mainly focuses on the clinical aspects of every subject. For example, let me give the example of anatomy. Previously in anatomy, if they wanted to ask you about the median nerve, for example, if they wanted to ask you about the median nerve as a long essay question, they would directly ask, describe median nerve under the following headings. Describe median nerve under its following headings, like its course, what are its branches, in the hand, where all is its sensory nerve supply, motor nerve supply. So they would directly ask this question. But now what happens is, they start the question like a patient presents to the OPD with so and so symptoms, and finally he is diagnosed with carpal tunnel syndrome. Describe the nerve involved. So as you can see, the concept remains the same. If you have read median nerve, you know that the carpal tunnel syndrome is related to median nerve. So you have to make a correlation between what you have understood and what you have to write. Previously there was no need to correlate between the two things, but now you will have to correlate and apply a little bit of mind. So the concept has remained the same. In most of the exams, what happens is just the pattern of asking the questions is different, but the basic concept will always remain the same. And guys, one more thing that I wanted to speak to you about was the changed criteria for eligibility and for passing. Previously, in order to be eligible to sit for the final university exams, the best of two internal examinations was considered. But now, from the 2019 batch to next all the upcoming batches, it will be the average of all the three internal examinations, which means you will have to secure more than 40% marks in all the three internal examinations together in order to be eligible for final professional examinations. And the changed criteria for pass is that I would like to explain with anatomy exam. If you want to pass in anatomy exam, as there will be two exams of 100 marks each, in each of the two papers you will have to score above 40. In one paper in both of the papers you will have to score above 40, and both together it should be above 50%, which means you cannot score 38 in one exam and 62 in the other exams, which if you score you will be considered fail. But if you score 45 in one exam and 55 in 55 or 56 in another exams, then both together it will be 100 or 101 or 102, then it will be considered as pass marks. And guys, one more thing that I wanted to speak about was previously the YOC marks were added to theory exams. If someone had a deficiency of some marks, the YOC marks which were added to the theory marks and they would pass the students. But from this curriculum there is a change in this procedure. The YOC marks are now added to practical exams and not to the theory exams. So theory exams must be you have to pass the theory exams on your own without any aid. You have to secure 50% marks in theory exams without any aid from other exams like YOC or any other practical exams. YOC will be added to your practical exams. This was one of the points which I wanted to focus on. So guys, these were the main changes that have been made to the competency based medical curriculum. To summarize this video, I have discussed mainly 4 important changes which have a vital role. One is the introduction of competencies. Those are the main priority topics. Next is the pattern of exam or framing, how the framing of questions has changed, and the eligibility and passing criteria which I have elaborated previously, and YOC marks which have been which will be added to your practical exams and not to your theory exams. So these were the main points, guys, and I apologize if I had missed any of the changes, and I would also advise you to go through the main document once again to get clarified with the other changes. Thank you.